Okay. Good evening, everyone, and welcome to our third in a series of health conversations hosted by Center for Change. I'm Monica May, and I like to say I'm your interweaver or your moderator for this evening. May is Lupus Awareness Month, and we have a very healthy, robust conversation. We'll be talking about lupus and women of color. We have a wonderful subject matter specialist and two very open advocates who will walk us through their journey with lupus. But before we begin, Center for Change, of course, has a few housekeeping issues that we just want to share with you, and they're not really issues. But before we begin, we have a very simple pre-test, and we'll close out with a post-test. And why do we do that? It just gauges how much we've been able to share with you that you retain. And it's not a test of sorts, but it just helps us make improvements and helps us to know where we need to forge more information towards. So while you're waiting, we're going to give you just 4 simple questions. Okay.
All right. Sorry about that.
That's okay. That's okay. We're going to close the pre-test right now, and we're going to get set to go. If you're ready, we can begin by introducing our subject matter specialist, who tonight is Dr. Chiaka Oparocha. Her specialty is internal medicine. She practices at Dedicated Care and has been on a mission to pursue a career in medicine all her life. She, quote, became certain that she wanted to spend her career giving back to her community and empowering the underserved, especially those with manageable chronic medical conditions. Now, she strives to empower patients and greatly values communication. Nothing better than to have a doctor who wants to talk with you. Yes. She says that many of us have more in common than not, and she enjoys finding those similarities in addition to discussing our differences. Dr. Oparocha says that if she could change anything about the current healthcare system, she would do so by increasing accessibility and mental health services. In her spare time, Dr. O loves spending time with family and friends, traveling and dancing. I wanted to share a bit of her education. University of South Florida for her undergraduate degree, Florida State University for College of Medicine, Orlando Health Internal Medicine Residency. She also sits on various boards, including the American Board of Internal Medicine and the American Medical Association and the American College of Physicians. So, family, that's who you are now. I want to introduce you right now to Dr. Chiaka Oparocha. It's yours.
All right. Thank you so much, Mrs. Monica. Hello to all of the panelists. Thank you so much for joining us tonight. I'm very excited to be talking about this topic of lupus, especially in underrepresented women of color that it primarily affects. So without any further ado, we'll go ahead. So what is lupus? It is a chronic autoimmune disease that causes inflammation and pain in different parts of the body. We hear the term autoimmune quite often. A lot of people might not know what that means, but essentially you have your immune system, which is your body's protector. And for one reason or another, in these type of diseases, your body begins attacking its own cells, and you have to take medications to essentially suppress your support system or your immune system in order to treat it. Most commonly affected areas are skin, joints, and any and all of your internal organs. There are 4 main types of lupus. The most common is systemic lupus erythematosus, which is seen in approximately 70% of cases. You also have cutaneous lupus, which is limited to the skin, drug-induced lupus, which typically can be seen in fairly common medications such as anti-seizure medications, some hypertensive medications such as hydralazine and methyl-dopa. And in these particular cases, once you stop the medication itself, the symptoms should go away. Unfortunately, sometimes these medications can trigger underlying lupus that was already there. So even after stopping the medication, your symptoms can still persist. Then you also have neonatal lupus, which is affected or does tend to affect babies from lupus positive mothers. And those symptoms tend to go away. They don't typically have long lasting effects. Going into symptoms and triggers, lupus is sometimes simply fatigue alone can be a symptom. You can also get headaches, arthralgias or joint pain, swollen joints, photosensitivity or sensitivity to ultraviolet sunlight rays, fever, hair loss, which can be known as alopecia areata. And then the classic sign that we all learn about is malar or butterfly rash that typically affects the cheeks. People can also unfortunately get sores in the mouth and nares, which tend to be painless. And then also just exhaustion alone. So, and on the bottom, there is a fun fact about silica being one of the strongest or most commonly studied risk factors for developing lupus. Again, typically this is in people who already have some sort of underlying autoimmune disorder, and the exposure to silica tends to bring that lupus alive. And this is not just touching silica products, it's people that are usually inhaling it over a long period of time, usually mining or people that do glass production. Diagnosing lupus. There are a couple of different ways that this can be done. Of course, there are blood tests, which tend to encompass a complete blood count, antibody testing, clotting time test, and complement testing, as well as urine test and biopsies. For most people, you have 11 criteria that we tend to look at, and you need 4 of these criteria in order to diagnose lupus. If you have any of these 4 and any combination, then you can go ahead and say you have lupus. And at-risk populations, so literally anybody can get lupus, but 9 times out of 10, these diagnoses are going to be in women from ages 15 to 44. It can be hereditary, so if you have family history of lupus, approximately 20% chance that you may develop it as well. And unfortunately, women of color are 3 times more likely to get lupus than our white counterparts. And of course, it's also more common in minorities, including African Americans, Asians, Hispanics, Native Americans, and Pacific Islanders.
Camille's born and raised. She's a Brooklyn, New York lady. She currently resides here in Central Florida. Her journey has been fueled by an unrelenting passion to empower people and educate them about lupus. She received her BS in Human Service Management and has worked in social services with children who were abandoned, abused for over 6 years. That's what she did. During that time, she went back for her MBA and also pursued her dreams of working in higher education. She's at Valencia College, and in 2017 became a faculty member and a pivotal part of the human resources team. She's doing double duty, family, all of that. She became a lupus advocate back in 2001 when she was diagnosed with systemic lupus erythematosus, and she's going to pronounce that better, which has affected her heart, lungs, and kidneys. Camille, like Ms. Gabrielle, has learned to navigate the world of balancing normalcy with lupus, although when I read this, as normal as it can be. She gives by speaking at local seminars and mentors patients and families about their lupus diagnoses. We also are going to take a moment to speak to a former newspaper journalist and lupus advocate. I've worked with Gabrielle on occasion when I was doing the Tom Joyner Take a Loved One to the Doctor Day. Gabrielle uses her experience of living with a chronic illness to candidly spread awareness and champion better patient outcomes, particularly in the Black community. Her passion for advocacy was sparked when she was diagnosed with lupus in 2009. And here's what triggered her. She couldn't find many Black women lupus patients online for support in our community either. With a mission to fill that void, she's become the voice that she was looking for. And she has supported the lupus community through social media, by connecting one-on-one with many patients that have become like family to her. And although she's had some life-changing experiences as both a lupus and dialysis patient, Gabrielle found a way and finds a way to provide lupus education and awareness in our community and on the national stage through advocating for lupus research in Washington, D.C. She's particularly proud of creating a seat at the table for patients by partnering with pharmaceutical companies to provide a patient's perspective, mainly Black patients, on critical lupus medications and bridging the gap between the patient and pharma communities. So we do want to have some questions that we can ask these ladies. And we can start with either of you. When did you first learn of your lupus diagnosis? And I think we got some answers. What type of lupus do you have, Gabrielle? And I want to get more clarity on Camille's.
I was initially diagnosed with systemic lupus erythematosus, and don't worry, Ms. Monica, it's hard for every lupus patient to pronounce this, so don't worry about that. And then a year later, kidney disease, which is formerly called lupus nephritis, kidney disease was brought on by lupus. So in July 2009, I was formally diagnosed with, we'll call SLE. And then lupus nephritis came into the picture about a year and a half later. And that is what I've been dealing with all this time. Ups and downs, as you said.
Yes, and one of the things that I love most about both of these ladies is that if you follow them on social media, they're very open about what they're going through. So when Gabrielle got her transplant, her kidney transplant, we all knew about it and we all cheered her on, and she's done very, very, very well. Thinking of that, and when we think of social media, do you feel as if you're sharing too much? Do you want to share even more? What does that make you feel, Camille?
Well, for me, it's pretty interesting. For a really long time, I was actually very private about my diagnosis. I was diagnosed initially in 1997 and was told it was a misdiagnosis, and then re-diagnosed in 2001 when I was pregnant of my third son. And so it was really interesting because you feel like if you share with people that there are issues, they're going to judge you. They're going to look at you in a manner that may be uncomfortable, especially in your younger years when there's an expectation of you to have an immense amount of energy and to do things. And it was pretty difficult when I look at it in those terms.
Mm-hmm. What symptoms were you experiencing that actually made you go? And did you ask, was it found during a routine visit?
So I was having extreme exhaustion, a lot of joint pain and headaches, and I just couldn't understand why. And that was, again, back in 1997. And once I was misdiagnosed, I spent years just thinking it was normal to feel this way. I had, at that time, I had 2 small children. And so the assumption was, well, it's just, you're a parent and you're working and doing all these things. And so you're just tired from that. When I was pregnant with my youngest son, I started getting the mylar rashes. And at that point, I was told again that it wasn't lupus, that it was something called PUPS that pregnant women get. And so I was continuously misdiagnosed until I saw a dermatologist. And that's who actually diagnosed me and sent me to a rheumatologist.
Mm-hmm.
Yeah.
Gabrielle, your experience with being diagnosed?
Yeah, so crazy story. I was actually a newlywed, working on, having a nice dinner, a nice Valentine's dinner, a nice outing with my new husband. And that day, all the lupus symptoms started to appear. And I didn't understand at the time that that's what was happening, but my body was inflamed. I was just really tired. I was really sore. And I thought that it could be fixed with a good amount of Tylenol. And when that didn't resolve the issue, I got an impromptu appointment with a massage therapist, just thinking I was stressed and I just need to relax. And all that did was spread the inflammation through my body. By the time that I got to my husband to celebrate Valentine's Day, we did not go to dinner. We ended up in the ER. And I would stay there 3 to 4 days while the doctors try to figure out what was going on with me. Even though this was not 1997 or even, in the 90s, this was going toward the mid 2000s, there was still not a lot of information that doctors knew. And so that's why I was in the hospital for 3 or 4 days, and all they could tell me is that my white blood cell count was out of whack and that I was severely dehydrated and I was released. Thankfully, at the time, I had a minority doctor who was Hispanic and was really well-versed in autoimmune diseases and had really probably all of his patients, if not all of his patients, most of his patients anyway, were minority patients. And so he was familiar with the symptoms and everything I was seeing, and plus the labs that came back and gave me a diagnosis of connective tissue disease, which is a general overall autoimmune diagnosis. It wasn't until I saw a rheumatologist 5 months later, and I was diagnosed July of that year officially with lupus, systemic lupus erythematosus.
Let's talk about the mental strain that put on you, the relational strain that it put on you.
Mm-hmm.
You both are very young women, newly married. Gabrielle, been married for a moment, 2 children, and then you would later have a 3rd baby, Camille. That's something that I'm wondering if women are thinking about or just worrying about. Well, I've been diagnosed with lupus. Will I be able to have children?
Mm-hmm.
Let's talk about that.
Really good points, Monica. To be honest, in that 3rd pregnancy, it was extremely difficult for me. And most of that pregnancy, I was in and out of the hospital because they couldn't figure out how to balance. My hormones were all over the place. The pain levels, I could barely move. I was so swollen. And so like you, Gabrielle, I spent probably the first 6 months of my pregnancy, 3 or 4 days out of the week in a hospital. And I was told that I, at that point, it was not the smartest decision to look at having additional children because it would be a really difficult decision for my husband and my family that we wouldn't want to make. And so it was extremely stressful. And I think I'm super thankful for my support system and my husband and my mom and all of my family, but just understanding the fact that lupus just isn't a very visual disease. And so it can be one of those circumstances where people are wondering, well, how could you be in pain? You look fine. But fortunately, to the point of relationships, the people in my circle really understood and gave me grace.
Mm-hmm.
Gabrielle, what about you?
Sure. Mentally, I was in denial. I was very much a busybody. I think we talked about this before. I was a type A, had personality and was just on the go. And so it slowed me down considerably. Being a young wife, we all have these societal expectations and things that we want to do. We want to be there for our husbands. We want to cook. And, I had that very much the fairy tale examples around me of what it meant to be a wife. And that totally had to be redefined. And then, just thinking about, having to use arthritis cream at 26, 27, because my joints were just on fire. So there was a lot of things that I internalized that I wasn't ready or didn't have the tools mentally to really express. And so there was some struggle in the beginning. Thankfully, I had gotten to a point where I knew I had to be open with my husband and therefore be open with my family, and then therefore be open with the community, because I didn't want any woman or any patient that I come across to feel as if there wasn't someone there for them, because I felt that. And I don't know about you, Camille, but in the Black community, there's a stigma that we have to keep our business to ourselves, and we can be very private people to the point that it can be detrimental to our health. And I did not want to continue a pattern of toxic behavior when it came to health diagnosis, which is one of the reasons why I jumped into being an advocate. I just saw the need, and I saw a need that I wanted to get, and I wanted to be that. As far as relationally, without a doubt, it took a toll on my marriage, because we were young and we didn't, we took vows, right? But nobody thought that we would need to so much walk these vows out the first year.
Yeah.
Yes, very much. I mean, we were married in November of 2008, and I was experiencing lupus symptoms February of 2009. So you can imagine, I'm just thankful that my husband and I had a really great friendship. We met in college, and so we had known each other for a good number of years. But I can't imagine if we didn't have that history and we didn't have that foundation as friends, how things would have gone, honestly, because it was a lot. It's a lot for anyone. So, with my husband, we worked it out. There was some education that we both needed. And I'm glad that he took the time to get to know what was going on, because that's not always the case. With my family, honestly, there are some people close to me in my inner circle in my family that have taken the time to learn about lupus. There are some who just are not ready, can't really relate, or are just not willing. And that happens, right? And so that's why blood is not always family when it comes to, lupus. They're family in other ways, but they may not have the capacity to support you. And that's why building your community, whether it be friends, whether it be family, whether it be people in the lupus community, is important to have people around you who are willing to shoulder some of the pain, right? We need that. We need to be believed. Like Camille said, we present ourselves well, and we need to be believed that we're going through. We need somebody to talk to. So yes. Community is definitely important.
We're going to bring Dr. Okorocha back into our discussion. And ladies, don't go anywhere, because we've got some more questions for you. We're going to talk about the impact of lupus now in the US, gender, race, and ethnicity. Dr. O?
All right, here we go. So impact in the United States, it affects approximately 1.5 million Americans with about 16,000 new cases per year. As you can see from hearing both Gabrielle and Camille's testimonies, no cases are alike whatsoever. You can't use a blueprint for one patient and apply it to another, because everyone responds to medications differently. Everyone has different symptoms that they present with. So it's just literally starting from scratch with each patient that you encounter. Costs are definitely there. You can incur over $21,000 per year just based on treatments. A lot of these immunosuppressants are expensive. Unfortunately, not everyone responds to the typical oral tablets, and do have to go through infusions, which can be used as chemotherapy agents as well in order to get their disease under good control. As far as gender goes, it does disproportionately affect women, with about 90% of people living with it being women. And it's also one of the top 20 leading causes of death in females ages 5 through 64. Unfortunately, people with lupus are at increased risk of getting other diseases, heart disease or coronary artery disease, osteoporosis related to long-term steroid use for people that are having flares or need to be on chronic steroids for pain control. So those also play a part in at-risk or underrepresented populations. So just think about it. Most people graduating classes, approximately 200 to 300. So imagine that being a class of about 500. If that's all Black women, one in that class is going to end up with lupus at some point in their lifetime. There's also increased mortality in underrepresented minorities as well, namely Blacks and Hispanics. And some some of that is because of lack of access to care, unfortunately, or not really taking your symptoms seriously, or providers as well not taking symptoms that are presenting to them seriously, and then leading to a diagnosis at later stages where you are having increased risk for mortality. And then for unknown reasons, Hispanic women do have more heart problems than women in other groups as well. Alrighty, and this kind of goes into health disparities noted in African Americans. So again, more likely to have organ system involvement. You can get inflammation of your heart, inflammation of your lungs, more serious complications, some of that being because of the fact that it's detected at a later stage, more active disease because of less access to treatment options, less social support, as we heard from Gabriel. Unfortunately, it can also develop at younger ages, and again, the higher mortality rates mentioned before. As far as impact on lifestyle, so just because of the exhaustion that a lot of people experience, you do or may end up not wanting to be as active or around other people, so you have inhibited social activities. There's also a good proportion of people that suffer with chronic pain because of lupus, and of course, if that's the case, you don't feel like doing anything. It can impact your employment. People have lost jobs due to their symptoms and unfortunately don't always qualify for unemployment benefits. So, and then as far as treatment goals go, the key is trying to find the right doctor, number one, that can aid in the diagnosis and then can aid in the treatment. If you're seeing someone, I'm always an advocate for finding someone that listens to all of your symptoms. If you're seeing someone and you feel like you're being poo-pooed, you're paying insurance. Go find a different doctor, get a second opinion, and then hopefully get the referrals that you need for specialists that can treat you with medications for your specific disease and can tailor a treatment plan to you and your symptoms. The goal with any treatment, as far as lupus goes, is to try and minimize the amount of flares, which unfortunately can happen no matter what treatment you're on. And we also want to minimize progression of the disease done with medications, which again are usually ones that suppress your immune system. There are also some alternative therapies. And then of course, there's always ongoing clinical trials trying to get new medications on the market to help as many people as possible. All right, and then as far as managing lupus goes, of course, you know, there's always going to be, you know, a nice little diagram of things that you should be eating, shouldn't be eating. The key is to maintain a healthy diet. Whatever that healthy is for you, then stick with that. Again, no two cases of lupus are alike. So something that may trigger symptoms or a flare up for one person may not trigger it in another. But as you progress in the disease and get to know it for yourself, you'll be able to identify specific triggers for yourself and then avoid those. But of course, we always recommend physical activity, exercise, taking that time for yourself, and of course, having a wonderful support system if possible.
All right, Dr. O, thank you so much. And we're going to bring our advocates back in. And again, we're talking with Camille Hernandez and Gabrielle Davis, two women who are living with lupus. Both women have children, both are married, and both have gone through the mental impact, the mental health impact of a diagnosis, and then developing their own tribe. That means they had to go out and really learn about the disease, develop family members and friends who were going to go this journey with them. And you know, when you're in that kind of a situation, you got to think fast, but you got to think about yourself. All right. How often, Gabrielle, do you experience symptoms currently? We know that you've been diagnosed, you've been on a medication regimen, but still, how often do you experience symptoms now?
I can say they have, thankfully, lessened significantly since my transplant in July. I have better energy, but pre-transplant, I used to have laundry lists of things that I wanted to do and could probably only accomplish a couple of them. So I can do a little bit more now, but I still don't try to do that list, that big list. I noticed when the rain, like we're in our summer rainy season coming, I tell people that I'm like a barometer as far as when the rain is coming, because I can feel it in my knees, I can feel it in my joints, and I can tell people it's gonna rain today. I don't need to look at the Weather Channel. I don't need to look at an app. Just go by me, and it's gonna rain today. And sure enough, it does. So I feel like a deep ache in either my elbows or sometimes in my temples or my knees, especially. I really don't have a lot of inflammation unless I'm stressed. That's how I know that I need to back away and look at the big picture and see what I can take off my plate, or what situations or events I no longer need to be involved with. And that usually resolves itself. So, but even pre-transplant, I dealt with the gamut of everything, from inflammation to soreness in my mouth to I had I don't know if you guys can see it, but I have some leftover scarring from cutaneous discoid lupus. So, you know, I have a pretty good case study of kind of the gamut of what can happen to you. Everything can be involved when it comes to inflammation, but I've experienced the kidney disease and all that. So, you know, but now it's pretty much managed, you know, to the best of its ability because of the kidney transplant.
Camille, let me ask you a different question. Does anything make your symptoms better or worse? Do your symptoms get worse at a certain time of day or season, like you mentioned?
Definitely a season, similar to, as Gabrielle said, the rainy season makes you achy. I actually ended up leaving New York because the cold was just really detrimental to right. And so the feeling, the aching in the joints. I also lived in a walk-up on the 3rd floor, and so as you would imagine, 3 young children, laundry, groceries. It was just the best decision to come down to Florida for my health. I too ended up with some side effects. Unfortunately, I've had a heart catheter ablation, which I believe was exacerbated, but I'm sure, Gabrielle, you've heard many a time that they don't know why you're feeling something and attribute everything to your lupus. So it's always that fine line.
Yeah.
Here's a good question from our audience. And again, please feel free to put your questions in the chat for us and the ladies will answer them. Or if it's directed towards Dr. Oparocha, we'll do the same. Here's a question. Does anxiety make lupus worse?
Definitely.
Absolutely.
Yeah.
Go ahead, Gabrielle.
Anxiety is stress. And so it's going to build and it's going to, you know, make those symptoms worse. I know I've personally been in situations where, you know, things start in your mind and you internalize, and, you know, we talked about mental health, and that's why it's so important to make sure that you're mentally taking things on as you should in a healthy way. Because there are some instances where I took some situations out of my life and I kind of made a mountain out of a molehill. And, you know, you start ruminating things on so much, and now your body is starting to exhibit physical symptoms from the rumination. Your heart, I literally looked at my Apple Watch and could see that my blood pressure, my BPM, my beats per minute is at 122 in a situation that I was in. I had put myself in. Okay, sometimes you got to take ownership. And my BPM was at 122, and I knew, let me back away from this situation because it is causing now physical ailments in my body, and I need to back away. So anxiety definitely can lead to an exacerbation of symptoms, for sure. It's a form of stress.
Dr. O, here's a question for you. Is lupus like diabetes, meaning is it ever cured? or do you just have to manage it? And then the second part of that is lupus hereditary or genetic?
So I wish it was something that could be cured, but it is a disease that has to be managed. And unfortunately, at times it can be progressive. And hereditary or genetic, I mean, approximately 20% of cases can be seen as familial, but not always. Lupus can arise out of nowhere. I've had patients with no family history just develop it. So.
Okay. All right. So let's do one more question for the ladies while we have you. And I wondered this with Gabrielle, because I can remember sometimes this was before the transplant, where remember sometimes you may be able to make it up to the station to do an interview, and then there were times where you couldn't do it. You just weren't, or you weren't able to come to one of the health fairs that we were doing. You just weren't able to do it. Are your symptoms constant, or do they come and go? Like how are you feeling right this moment?
I'm a little tired, but I'm happy to say that's probably from a long day. One thing that has come into play that I didn't think about that I'm dealing right now with is that transplant has made it possible for me to do so many things. But with some of the medication, my nephrologist is saying that it causes hot flashes. So just being very transparent, because we talked about that, I just turned 40. Okay. And unfortunately, I went into early menopause due to lupus. Like I said, it can attack any system, and it definitely attacks my reproductive system, which is, I know we might touch on this right now, a little later, but I have a child through surrogacy. So it definitely impacted my reproductive system, and I went into early menopause. So I have hot flashes probably normally through that, and I also have it due to the medication, and it is definitely wreaking havoc on my sleep. So I am pushing through a little bit tonight, but right now I can just say I'm a little bit tired, but I rejoice in that, because there are times where I might have had to cancel on y'all and be on the couch, you know what I'm saying? And pre-transplant, those are the things that I had to assess in my body, and that I know Camille is familiar with that as well. We have to take inventory of our bodies to see what we can do. And we also have to learn boundaries and saying no and being okay with that. And as we progress and we get a little bit more wise and living with lupus, those are the things we probably have pat down now, and telling people no, because I can't do it. I don't have the capacity, you know.
And
Definitely.
Camille just had treatment today. How are you feeling?
I did. So I get treatment every 4 weeks via infusion, and it leaves you somewhat lethargic. It leaves you definitely have some after effects. And so I probably, after this, in all transparency, will probably lay down. But those are the things that you think about. You try to reduce your stress by setting realistic goals. I'm laughing because my husband just put something in the chat that said learning how many spoons, and that's a lupus term, right? You can't give away all of your spoons. You've got to be able to know when you wake up, today might be a day that I've only got 2 spoons. One of the things that I'm so thankful for is my employers. They are so understanding, and really allow such flexibility. I work remotely right now since the pandemic started, but even before that, I've just had a great support system, even through my employer.
Dr. O, okay. Dr. O, one lady, and I'm going to see if I can capture her name, Christine, wants to know, my daughter was diagnosed in January of 2020 when she was 15. She's a junior now and looking to go into college. Any thoughts on how she can manage stress with this disease in that environment? These ladies just gave you some very, very good insight on that. Think about the spoons. Yeah, but Dr. O?
It's a tough balance, and I am definitely a fan of outsourcing. If you don't have that support system within your family, find a therapist that she can get involved with now and hopefully get a good relationship with that can follow her throughout her college journey and help with stress relief and techniques throughout that. So because the key is getting that stress under control and decreasing the amount of additional inflammation. Your body already, just because of the lupus alone, will have its flares, but you don't want anything additional if you can help it.
Absolutely.
And you know what else I would say to her? I know you may want to pledge. I know you may want to be on the dean's list. And I know you may want to get involved in a relationship. But you know what? You can do all of those things if you just temper your time. And with this disease, you really have to manage your time, and you really have to manage the word no.
Also giving yourself grace. I mean, knowing that it's okay if you can't get the same things done that someone that does not have lupus does with no difficulty. That's okay.
Absolutely.
Yes. Dr. O, let's go back to the slides for just a moment because we're getting ready to come to a close. If you have any other questions, I thought we were going to hit some more information, but let's just do some more questions. And if that is all the information that we're going to share this evening, and that is fine. What advice do you have for those living with lupus? And we can go one by one. Gabriel, you tell me, but wait, you know what? Let me start with Dr. Operocha.
Sure.
What advice do you have for those living with lupus? First, good diagnosis, get a good diagnosis.
Get a good diagnosis, find a good support team. And that support team is more than just one person. It's more than just your family. It's going to be having a good doctor, a good specialist. If your disease is not under well control and you do have to continue following with the rheumatologist, a good nephrologist if you end up having kidney disease, or cardiologist if you end up having, unfortunately, cardiac manifestations of it. And then outsourcing, as I said, and giving yourself grace.
Okay. Camille, why don't you give a shot at that? What advice do you have for those living with lupus?
The first thing I would say is, although your mental state may immediately have you thinking you can't do something, find the courage within yourself because it can be done. It may not be done in the same timeline that you initially had for yourself, but you absolutely can live with lupus. As I was newly diagnosed, it was really hard to comprehend that. And as I'm going through life, I've learned that as I walk this journey, that it is a graceful walk with a limp, with a or whatever ailments I have, but I continue to push myself with my support system and understanding that we are blessed. We are absolutely blessed. And I don't think that I was ever given a battle that I could not fight. And you can do that too.
It's good to hear. You want to tag team on that one?
Yeah, definitely would say that your wellness starts and has to be grounded in your mental, because anything that your mind thinks, you will go that path. So if you think that you're not going to do well, if you have this cloud over you that you continue to walk in, and that's perfectly normal, perfectly normal. Like I said, I was in deep denial. I was in a place that I wasn't accepting what was going on with my body. But if you can get grounded in mental health, and I have been an advocate of therapy, and that's why I was so happy to hear Dr. Operocha mention mental health and getting a therapist. That is key. We need help sometimes in sorting out our feelings and dealing with life. We're already dealing with the diagnosis. Sometimes we need help in dealing with the mental. So being grounded in mental health and having good mental health practices, reshifting the way you think about things. And I always say, anytime I have an opportunity to share, you must be your own best advocate. People love us, right? They love us, but they cannot do the work for us. We are the ones that have to do the research. We are the ones that have to look into different alternatives. We are the ones that have to understand what lifestyle and what eating habits and all the things are right for our bodies, because we're the ones in our bodies. So while we have our support team, we have our circle that loves us, ultimately, it's up for us to take our medicine. It's up to us to make those appointments. And it's up to us to follow through on what we need to do to be better. So it starts with mental health, and mental health, our right mind shift will go into doing the things that we need to do to have good treatment plans and to live the best life that we can have possible. And I absolutely believe we must not compare ourselves against those who don't have our fight. We cannot do it. We will make ourselves sick comparing ourselves. I've been there, and I'm telling you from a place I know. You cannot compare yourself to people who are not dealing with your fight. It's not fair to yourself. So grace upon grace upon grace. Measure yourself in the place where you are, not here, here. What did you do yesterday? Are you better? What did you do last year? Are you better? That's where we need to measure our progress. And keep hope as a constant. Hope is going to carry you through. Hope for better days. Hope for a better future. I had a vision that I would be able to rumble and tumble with my son, and glory to God, I am. So hope is something that will continue to drive you forward. That's what I have to share.
Thank you. There was one question that popped up, and it's one that we answered a little earlier, but I'm going to ask Dr. Obarocha, can you get lupus later in life, like after the age of 50?
Oh, you definitely can. Unfortunately, I had a male case where he was diagnosed in his 50s.
A male case.
And ended up progressing and ended up on dialysis. Yep, you definitely can. There's no, I mean, despite the most common numbers or the ages of 15 to feminine women, you can still get it as a male. You can still get it at later stages as well.
Yeah. Let's just slide, no pun intended, right into our resource moment. Yes, the Lupus Foundation of America, you'll see the number there. It's 1-800-558-0120. lupus.org/about-us. The Lupus Foundation of Florida is lupus.org/Florida. Lupus Research Alliance, which is lupusresearch.org. Centers for Disease Control and Prevention, that's cdc.gov. For information on lupus, you would just /heart disease, once again. And of course, Dr. Obarocha is with Dedicated Senior Medical Center, and that's the Hiawassee location. And Vanzella, her number is there, 863-308-1632. And if Gabrielle would be so kind to talk about Lupus Sisters, their Instagram handle is @Lupus Sisters and SISTAS.
That's right. We know who we're talking about.
Yes.
Yeah, you can find me there. And there I just share real life. I share instances with my son. I tell you in the moment information. And even on Instagram, I share stories about community members, women that are close to me. And I get a lot of DMs just asking questions. And so please reach out. It would bring me nothing but joy. If you have questions like the mom who wanted to talk about her daughter, I'm open to talking with you and helping you in any way I can. I love that. That is my life's work when it comes to this on the day-to-day, because, Dr. Obarocha knows that she can see you medically. And we also need people who are walking in our shoes to help us deal with everyday life. So definitely want to be there for you. And you can find me at Lupus Sisters.
This is so good, so good. And I know that at some point we will see our sister Camille out there in the streets and then managing things over at Valencia. Gabrielle, thank you so much for being here with us this afternoon. And thank your husband and your son for giving you space with us. And then Camille, your husband has been tapping in the whole night, as have both of you all's family members
I
and friends.
love that.
For that. That was so cool, so cool, so cool. We thank you so much for sharing this. And Tamisha and Michelle from Center for Change, and of course, Peggy, thank you for bringing interesting topics and healthy conversation and really subject matter specialists who can really make it understandable for us. Center for Change has some upcoming events. One is coming up next Tuesday, the 24th, 11 a.m. at Dedicated Senior Medical Center. Fabiola Gaines is a Black nutritionist, and I have to tell you, there are not many here in Central Florida. So good nutrition for active living, and these will be facts and tips for seniors with Fabiola. And again, that'll be at Dedicated Senior Medical Center. And then we're going to dig deep for your health with Dalton Deere, gardening tips for planting seeds for a healthier you. That one is May 26th, and you can click in order to register for both. Before we let you go, family, and that's everybody on the screen, you become our family, we do need to do that post-test. So we're going to put that up for just a moment, and we're going to say thank you very much for joining us. If you need to come and see us over at Center for Change, we're 6003 Silver Star Road, Suite 3, right there in Orlando. And our phone number is 407-271-4452. info@centerforchange.org is how you can reach us. And our web is flcenterforchange.org. This post-test will stay up for just a moment. Please, everyone who filled out the pre-test, do us a favor and fill out the post-test. We want to make sure that we hit all of the marks that we think that we were able to hit tonight. And we want to make sure that we leave you with all the resources and all of the information. Again, Gabriel, thank you so much for being here with us this evening. Camille, go and rest. I know both of you have had long days, and Camille has had her treatment. And
Yeah.
Dr. O, how many patients did you have to see today?
We don't want to go into that number.
Okay.
A lot.
Yes. So we find it not robbery for all of us, because I did a groundbreaking early this morning in the early morning heat for Legends Academy in the Washington Shores area. So and been moving ever since. And we teach a cooking class on Wednesdays too. So right after that, came here. I am so grateful to Center for Change for making sure that I'm with them for each one of these. Again, my name is Monica May, and we just thank you for being here. Get set for our next one. You will hear more about it on social media. All right, give a few more moments to our post-test.
I just want to say a quick thank you as well. I feel as if this was really a great opportunity. Gabrielle, I know you've been doing this for a while, but it gave me an opportunity to jump in and really help myself through the process of lupus by sharing my journey and being that point of contact for those who are looking for support as well. I've definitely made a friend in you. Thank you.
Oh, thank you.
Look at that.
Yes.
Lupus Sisters for Life.
All right.
Yes.
Already.
I like
Yes.
it.
Yeah, it was an honor to be with you ladies. And like I said, I jump at any opportunity if I have the capacity to educate. So I'm happy to meet you, Camille. Hopefully we can get together in real life. Let's make that happen. We can exchange information. So
Perfect.
Dr. Opa Rocha, it was a pleasure, and thank you for sharing your knowledge with us this evening. So with that, we're going to wrap up and say good night to everyone. And thank you so much for spending at least an hour of your evening with us, Center for Change, as we discuss lupus and women of color. Good night.
good night, everyone.